In this first technique, we're just applying some very on the surface but firm fascial stretching. You'll see throughout this clip I'm going to preference 4 different directions. This one is going to be a superior fascial glide with knee extension. There's also going to be some lateral and medial pins with hip rotation, and finally there will be a glide away from the pelvis. So just observe all 4 directions of fascial stretch. You can do the pinning assessment where you feel all directions to see where the fascia is tightest, or just in this case I would recommend just practicing all 4 just to get a little bit of experience with fascial stretching in all directions to prepare the hamstrings for deeper work. For this part, you're going to see I'm going to create a bridging effect between the thoracolumbar aponeurosis and the hamstring. So my lower palm is contacting just below the ischium, and my upper palm is just lateral to the spinous processes. And it's kind of like if you do a downward dog and you get that nice open stretch across the low back. This is the same idea, just opening up that fascial bridge as the hamstrings feed into the sacrotuberous ligament, feed right into the lower back. So this is a really wonderful opener for the hamstrings and just in general for that lower back. Here you're going to see Reagan firing both the medial and the lateral pairs of hamstrings, and you want to think of these as two areas of target. So now that we've warmed the fascia, you'll see here with fingertips, I'm going to be targeting these pairs with direct work intra-belly. So I'm targeting the belly. So there'll be two lines, one along the lateral pair, and then you'll see another along the medial pair. You want this to run from the tendinous and muscular juncture just above the knee, all the way up to the ischial tuberosity. At this point, you're going to see that I utilize some active knee flexion while compressing and gliding. This is something I like to do on occasion for those that can handle a little more dynamic work. So just an example here of how to integrate some active motion with the technique. So getting to this medial pair of hamstrings can be a little tricky. So I'm repositioning my body here. I'm bringing the knee into flexion so I can sit on the table and get a better angle at these muscles. With the knee flexed, it does slack the muscles a little bit, but it makes the body position far more comfortable. All right, for this next section, we're going to be looking at It's going to look very similar to the previous, but you'll notice instead of 2 bundles, I'm outlining 3 lines. These 3 lines are the intermuscular septums of the hamstring. So I'm starting with this lateral one here. This would be where the lateral hamstrings would articulate with the iliotibial band, and they often tend to get stuck when there's dysfunction and ischemia in the area. So you want to spend time in that valley, just outside of the lateral hamstrings, separating hamstrings from the iliotibial band. You'll see next I'm going to go right into the middle of the hamstring bundle as the lateral and medial hamstrings will begin to stick together, which is not advantageous during things like knee rotation and pivoting. And finally, I'll be isolating a medial septum between the medial hamstrings and the adductor complex. Now, you can glide with this, but oftentimes as I feel things sticking or stuck, I will stop and I will sort of do this slow sort of friction and opening. I think we'll see it best with that medial line, but this is unlike the intra-belly stuff where we're going for depth and possibly edge work. I'm really kind of focusing on getting things separated, and the word I like to use is teasing them apart. So, work with body work is very, very slow and very diligent. So sometimes it's hard to tell, but sometimes glides are really slow. This is a very, very slow glide here, but you'll see me teasing back and forth. You'll also see with my hip, I'm adding some rotary motions to the hip, which helps to move those hamstring muscles as well. That view makes it hard to see, but his foot is very much on the upper anterior thigh. So pretty safe zone to have contact there. And this you can kind of hang out in one area. I find like mid-thigh is really, really nice. You can go up towards the ischium, but just remember that these bundles all merge into one tendon. So you don't have to go all the way to the ischium here. Just really, really in the middle region of the posterior thigh is going to be best. All right, next we're looking at a more broad contact that, and the goal here, guys, and we want to utilize edge. We don't want people in pain. Slow compressive loads. I'm using the shin here as a tool. You've got multiple tools you can use, but the idea here is just to compress and use edge with the idea of getting depth. Now, I'm just showing locations here. I might spend a good 5 to 7 minutes per spot getting deeper and deeper edges with each release. Remember, guys, you want to get to the depth where they tell you to stop. Utilize breathing 20 to 30 seconds. They get a release. We want to go deeper. Now, the goal here is to get maximum release at depth to get to those deeper ischemic fibers. Now, here is an alternate option here as well. I'm using bilateral knees into the posterior thighs, and I can lean. So if that first technique doesn't work for you, the standing to the side of the table, you can mount the table, both knees in, and then just lean. My feet are to the outside here because it's more comfortable for my hips to be an internal rotation. But you might, a lot of people choose to put the feet at the inside. It's really, really up to you how you want to do this. You know, your choice, play around with it. Okay, here is another alternative for adding compressions. Obviously, standing and using feet requires, one, the right environment, and two, the right client. This is a lot of pressure using the weight of the body. You'll get some people you can get the whole body on. If you're working on a larger person that can handle a higher threshold of input, I won't be able to get my full body up on the Reagan, but just giving you a view of these compressions. And again, just showing you locations, not spending a lot of time in each spot, but if you are committing to this as a technique, you can really spend some time with it and really just get some deep releases in this tissue, which can be really advantageous. All right, one of my favorite techniques. This is a supine knee compression, and it is a compressive movement. But man, you can do a whole lot with this in terms of movement. But I'm leaning in with my knee and then pulling back simultaneously with my hand. So it's sort of a lunge and lean back combination, and you can just generate a ton of pressure with this. And you can add knee rotation, you can add hip motions. I mean, it's just a really great way to start compressing. If we go back to earlier techniques, I can target the muscle bellies. So here I'm kind of in the intermuscular septum between the medial and lateral hamstrings. So lots of options here. Really great one. Play around with it. This is definitely one of my favorites. All right, this I believe this is the final technique for hamstrings. This is taken right out of a Thai workbook, essentially a Thai technique. I'm using the foot to come in and compress hamstrings while I pull. And honestly, you're getting a couple things here. You're getting nice compressive force into the hamstring bundle, but you're also decompressing the hip joint. Probably not so much with Reagan, because as you can see, his hip is very tight. But if you can get that hip to drop out, you can get some nice decompressive load, doing a little better there in the hip. But really great, another great way to treat these muscles. All right, so we're going to be moving into glute max technique. Here I'm tracing sort of the attachments along the iliac crest, coccyx, and sacrum. There I'm locating the coccyx. And then I'm going to take thumbs here, and I'm going to apply frictions along the attachments of the muscle. This is something you can technically do with any muscle, but I find especially important for glute max as it crosses that sacroiliac joint. And it's an area that people experience a lot of pain. So spending some time frictioning there. Again, I'm moving through it quickly for visual purposes, but you can spend some time there. Now I'm taking an elbow directly into the glute max belly posterior, and I can bring the knee into flexion to utilize rotary motions, as glute max is a lateral rotator, and this helps to aid the release of the tissue at a deep level. So I say deep level, but remember, glute max is on the surface. If you're generating too much pressure, you'll be getting into those deep six, which is kind of in the same location. So, moderate pressure here, intrabelly release, utilizing edge and movement to get some softness in this tissue. All right, moving the client sideline. This is probably my favorite glute max technique. There I'm locating the greater trochanter. Make sure you find that. Move just posterior to it. I'm going to start with knuckles, and I'm going to pin glute max up and into the iliac crest, and I'm going to call for Reagan to do active hip flexion. So this is going to create a really satisfying and somewhat intense stretch into the glute max, kind of freeing up that posterior hip joint. And this is just one that I go to very, very, very often. This often is my go-to for glute max, period. I'll just go in and apply these stretches a couple times. And if they can handle it, I'll use a forearm, which will obviously generate additional force. And you don't want to roll the pelvis forward. So I'll use my left hand to stabilize the pelvis in the front. And this is just a really effective pin and stretch. And they can bring that knee all the way up to the chest. And this one's awesome. I love this one. All right, so here we're going to move into glute medius, glute minimus technique. Right above the greater trochanter, I'm pinning up towards the iliac crest from a position of abduction and then moving the hip into adduction, creating a nice pin and stretch. Remember, this pair of muscles is your primary abductors, so this is going to get a nice release along the most important elements of this belly, right up towards the iliac crest. All right, so once we get that fascial sleeve opened up, again, finding that greater trochanter and outlining these glute muscles like a slice of pizza, we want to get in and do some deeper exploration with fingertips right into the belly of those muscles. This is obviously designed to get more depth in the tissue, more direct into potential trigger points and areas of adhesion. The glute muscles will tend to stick to one another, so there's not any really teasing of structures apart per se, just intra-belly work, nice and patient into the belly of these muscles up to the iliac crest. All right, so again, finding the mid bellies of the medius, we can utilize some elbows for some static compressions, try to get some deep releases if these tissues are prime targets or referring pain into the low back. But this does not quite get to glute minimus. In order to get to glute minimus, which is an extraordinarily deep muscle, we need to create slack of medius by creating abduction, passive abduction, and reinvesting our pressure into that area right above the greater trochanter. So this allows us some really great deep contact into that glute minimus. Okay, our last set of muscles is going to be the deep six that sit between the greater trochanter and the ischial tuberosity. So we need to make sure that we find both those structures and bring our pressure right in between that valley of those two structures. So I'm doing that with thumbs here. So if we go to the higher end of that, we're going to hit piriformis. If we go to the lower end, we're going to hit quadratus femoris and the remaining gemellus and obturator in between. And generally when I go in, I'm trying to tease apart, like, do I want to spend my time with the ischial attachments or the gluteal attachments? You should be able to feel which of those two is tighter. Here we're going to look at a pin and stretch primarily for piriformis, although any of the deep six, this is good. So we're going to have our client go into external rotation. We're going to pin the tissue away from the gluteal tuberosity towards that sacrum or ischial tuberosity, depending on our targets, and then have them go into internal rotation. This creates the stretch we're looking for along those muscular structures. Finally, we are looking at a prone approach to the similar technique we just covered, finding the ischial tuberosity and the greater trochanter with both hands, going in between and feeling for that nice deep valley to go in and treat those deep six and piriformis. This is a lot easier, a lot less tender to the body. The sideline approach tends to be a lot more intense. So for those that need a more subtle approach, this is really nice. We also have the advantage of adding internal and external rotation passively, which again, if we're going here, allows for the ease that active movement does not. So this is a really nice way to start opening up this space of the deep six. And if we want to bring a little bit more oomph to the technique, we can transition to an elbow. Same thing, integrating internal and external rotation with the contact.